What is the relation between primary hyperparathyroidism and hypertension? Have you ever wondered how certain conditions can affect your blood pressure? Today, we are going to discuss the relationship between primary hyperparathyroidism and hypertension. This connection is quite interesting and worth exploring. Primary hyperparathyroidism occurs when one or more parathyroid glands produce too much parathyroid hormone. This leads to higher levels of calcium in the blood. Studies show that a significant number of individuals with primary hyperparathyroidism also experience hypertension, with estimates ranging from 56% to 80%. This rate is notably higher than what we see in the general population. So, what could be causing this link? One factor is how parathyroid hormone interacts with blood vessels. It can influence smooth muscle cells and calcium levels inside cells, which may increase blood pressure. While parathyroid hormone can also help blood vessels relax, many patients with primary hyperparathyroidism experience issues with blood vessel function. This can lead to less availability of nitric oxide, a substance that helps blood vessels widen, resulting in higher blood pressure. Another aspect to consider is how patients with hypertension and primary hyperparathyroidism react to certain substances that constrict blood vessels. They often show a stronger response to these substances, which can further elevate blood pressure. This increased reactivity is linked to higher calcium levels in blood cells. Interestingly, some patients find that their blood pressure improves after surgery to remove the overactive parathyroid tissue. This suggests that addressing the hormonal imbalance can lead to better blood pressure control. Additionally, individuals with both primary hyperparathyroidism and hypertension face a greater risk of heart-related issues compared to those with just essential hypertension. For instance, left ventricular hypertrophy, which is a thickening of the heart muscle due to high blood pressure, is common in these patients. However, this condition may improve after surgery. When it comes to diagnosing hypertension, it is essential to consider primary hyperparathyroidism as a possible secondary cause, especially in cases of resistant or unexplained high blood pressure. Screening for this condition typically involves checking serum calcium and parathyroid hormone levels. Identifying primary hyperparathyroidism can lead to better management of blood pressure and a reduction in cardiovascular risks. In summary, the relationship between primary hyperparathyroidism and hypertension is significant. The mechanisms involve how parathyroid hormone affects blood vessels and overall cardiovascular health. Addressing primary hyperparathyroidism can lead to improvements in blood pressure for many patients.